Hello, everyone. I hope you guys are having a great Sunday morning. Trying to remember what day it is here, but I appreciate you joining for the Ignite Your Run education series. Today, we are going to cover the topic of plantar fasciitis. So, super challenging topic, and for me to present, but also for those of you that have dealt with and are dealing with plantar fasciitis right now. A lot of mixed research out there, so it's hard to really condense that into a way that tells you, here, do this moving forward, right? It's a lot of there's misconceptions, there's this poor research, there's a lot of stuff really backing this, and I think that's the reason why a lot of people really struggle with getting over plantar fasciitis. We'll dive into some of that as we go here. What you always need to realize with these presentations is I do like to sift through a lot of research. There is so much research on plantar fasciitis. Unfortunately, none of it is great or really conclusive, right? We're studying a lot of things in a lot of different ways. How does exercise with insoles work? Insoles with night splints, ice, anti-inflammatories, right? It's really so wide and so varied, and that's why it's hard to really draw good conclusions from this information. But if you're someone that's a nerd like me and you want to sift through some of the research articles that I use to put together this presentation, you're welcome to screenshot this and to look up some of these things. Now, when it comes to the presentation today specifically, we're going to cover some anatomical considerations around the plantar fascia and foot. What is plantar fasciitis, right? Fasciitis in quotations there, and common misconceptions regarding this injury. This is going to be very important and hopefully allows you to kind of change your thought process regarding plantar fasciitis. And next, obviously, we want to cover some logical recommendations to address your foot pain. I just want to talk about plantar fasciitis and lead you nowhere. I want to talk about some basic things that you can do moving forward to hopefully prevent the likelihood of experiencing plantar fasciitis. Or if you're someone that's dealing with it currently, how do we rehabilitate, treat, and get over this condition once and for all? At the very end, there will be a Q&A, but you are welcome at any point if you have questions, anything that you're dealing with specifically, any insights, experiences that you've gone through that relate to this topic, feel free to drop a comment in the chat box. Okay, one second. All right, so first up, anatomical considerations. The plantar fascia is a thick fibrous band of ligament-like tissue. So ligament-like tissue, fascial tissue, we see this connection here on the right side of the screen. This ligament that's actually connecting the heel or the calcaneus with the metatarsals, right? So it spans that entire portion of the foot. If we look at this from a bigger viewpoint or a bigger lens, we actually see the plantar fascia as one piece of a longer fascial connection, right? So it connects metatarsals to the heel, Achilles, calf, hamstring, sacral ligaments, lumbar rectors, all the way up behind to wrap around right towards the eyebrows here, right? It's a very long fascial connection. It really depends on, going back to dissection, right? How it was actually dissected from cadavers to understand what is this tissue. Do we dissect it as individual tissue? Okay, that's our plantar fascia. Or did we look to understand that this is one long fascial piece that is connected from the eyebrows all the way around the backside to the foot, right? It's very interesting to think about. The plantar fascia is a passive stabilizer of the foot. So if you look here at this image in the left side, the A specifically, right, we can see we have our lower leg, we have a tibia and fibula, we have our ankle, we have some of these metatarsal bones and tarsal bones in the foot, and then we have this ligament that's spanning that bottom side there that actually provides some structure and integrity to the foot. Without that, some of the research has shown when they actually have cut the plantar fascia, the foot itself starts to lose some of that integrity. We start to go from having a slight arch to the foot will flatten to a degree, right? So it provides a lot of integrity to the foot. What this does, it allows us to absorb force and also transmit energy, right? So when it comes to ligaments, tendons, fascia, we use these tissues to actually create some support. So our muscles don't have to work as hard, right? We have these passive structures to support the integrity of the foot because there's so many bones and joints throughout the foot. So we need something that's going to pretty much the length of that from the metatarsals all the way to the heel that helps provide some rigidity. And then also you can see on the right side here, what's important when it comes to the plantar fascia is what's called the windlass mechanism. So what this is as we start to roll, if we're striking the ground, whether we're walking or running, we're going to the flat of our foot, we're loading, and then we're starting to extend into our big toe. As soon as we do that, we actually create tension throughout the plantar fascia. So this is a point where just through normal mechanics, we are loading into the big toe, tensioning that plantar fascia, and it helps create rigidity and structure to the foot. If we're unable to create this rigid lever, we don't have power, we don't have force as we push off. So it will require a lot more energy from our muscular system to propel the body. So that's where the plantar fascia really comes in. It allows us to maintain integrity of the foot. It allows us to store, release energy, and create this rigid lever so we're not so unstable and unable to push off with force. What's also important to realize, because we commonly think about the bottom of the foot being the plantar fascia under there, there's so much other stuff in the foot, right? So we look at these pictures right here, and these are just a couple layers. These are some of these smaller intrinsic muscles of the foot that help us move, that help us stabilize, that help us push off, land, absorb force, dissipate vibration, right? So we can't be short-sighted when we think about the foot and assume any type of pain at the bottom of the foot is plantar fasciitis. We have bones, we have tendons, we have ligaments, we have joints, we have small intrinsic muscles like these that you'll see everywhere throughout the foot. So just understand there's more stuff involved than just the plantar fascia. And it's commonly, because we don't look at it from this viewpoint, we commonly think of every single ache or pain at the bottom of the foot as, oh, I have plantar fasciitis, I'm developing plantar fasciitis. The symptoms had to be specific to be plantar fasciitis. But there could be a muscular strain, there could be tendinopathy, there could be some type of sprain at some of these midfoot ligaments. There's a lot of things that could go on at the foot. When it comes to plantar fasciitis, again, pain at the bottom of the foot, but specifically at this junction, right? This is where we're seeing the majority of pain when it comes to the plantar fascia. It's actually on the inside arch, but where that arch attaches into the heel bone or the calcaneus. This is the spot that you'll see the majority of complaints when it comes to plantar fasciitis. It's the inferior medial aspect of the heel. What's very interesting is over the last so many years, we're probably looking 10 to 20 or so, 10 to 15, is we're starting to see through the research and understand that plantar fasciitis might not actually be an inflammatory condition. So we think of if we strain a muscle, if we pull a muscle, if we have just inflammation in a joint or in some area, right, we're seeing some type of swelling. What we're starting to see through the research is plantar fasciitis might actually be a chronic degeneration of this tissue. Okay, so that changes things completely because we're so used to throwing anti-inflammatories. We're so used to icing. We're so used to rolling the bottom of the foot with a frozen water bottle, right? These are the things that are just the staples in plantar fasciitis treatment. But if there's no inflammation, are those actually warranted, right? We'll talk about that a little bit more in a second. So we actually are now starting to consider plantar fasciitis as plantar fasciosis or plantar fasciopathy. What this just means is it's a more chronic breakdown of the tissue itself that actually lacks an inflammatory process, right? So that's very important from a treatment standpoint, and we're going to dive into that more in a second. So when you start to see degeneration of a tissue, right, we start to see with our tendons, like we have Achilles tendinopathy, patellar tendinopathy, gluteal tendinopathy, right, all of these things, rotator cuff, we start to see tendinopathies or overuse conditions. It's usually the tensile strain is greater, the amount of load and force that we're placing on that tissue is greater than that tissue can handle. That tissue is not necessarily swelling up or becoming inflamed, but we're creating structural changes to the actual tissue itself that we then need to train and then to load and then to fix over a period of time to get over these conditions once and for all. We can't just ice these or take anti-inflammatories and assume, hey, the swelling is gone, I'm better. A lot of times the absence of pain is the first step. And then we load and then we rehab and then we train this tissue how to be stronger and more resilient. So then we can continue to be active for years and years to come. From a treatment standpoint, these are some of the common things that you'll see, and they're all over the literature, right? This is 70, 80, 90% of the research articles that I saw studying these passive treatments, looking at orthotics and insoles, looking at wearing night splints, taping, anti-inflammatories, right? We're, especially in the running community, we're very into some of these passive strategies. Let's do this to reduce inflammation, it will go away. Let's take anti-inflammatory to improve inflammation and it will go away, right? Let's support the foot, and so we're not stressing that tissue, and then this will go away. Unfortunately, if we have this chronic degeneration of the tissue itself, these things will only help so much. These are more so symptom modifiers than they are actually restoring the quality of the tissue to get past that injury once and for all. From a research standpoint, very mixed research, so it's really hard to say to you conclusively here today, but this is just a summary of the majority of the research that I read. There could be other research that says yay or nay, but this is what I found throughout the research and some of the more up-to-date and current research articles. There was no data to support the use of anti-inflammatories or ice, but the article did say because we use ice anti-inflammatories for other musculoskeletal conditions, it is a reasonable choice from a treatment standpoint. So it didn't actually help plantar fasciitis, but because we use it with other injuries, they recommend it's smart to use, although it wasn't really shown 100% to help with plantar fasciitis. Night splints were actually not shown to be effective if the plantar fascia symptoms have persisted greater than 6 months. So if you're someone that's been struggling with this for a long period of time, the night splint might not be your best option. But if you have just started experiencing this pain over the first 0 to 6 months, trying a night splint might actually be helpful to you. Results were actually more seen with custom-made night splints than the prefabricated. So if you go and just buy one off the shelf at Walgreens, that is probably not as helpful or as effective as if you get one custom-made from podiatrist or some type of orthopedist, right? So custom-made is superior to prefabricated. From a foam rolling and self-myofascial release standpoint, so into rolling, ball release, rolling the bottom of the foot with the ball. Research study actually showed that rolling the bottom of the foot reduced pain and increased ankle range of motion immediately following the intervention, right? This is nothing new. We know that foam rolling and self-myofascial release provides these short-term improvements in terms of mobility, flexibility, and reduces the perception of pain. However, the study didn't go into any long-term follow-up. So we don't know if this person felt better for 15 minutes and then their pain immediately came back. Were they a week later, a month later, 3 months later, 6 months later? We don't know if there was any long-term benefit from foam rolling and self-myofascial release, but we do know if you were experiencing pain at the foot and you're trying to just get through your day and allow that to feel better, it probably is helpful to do some type of foam rolling of the calf, ball release work into the foot. We just don't know long-term if that's actually going to help us in a positive manner, besides provide some short-term benefit. There were no studies that showed the effectiveness of taping. And for someone with my background, right, I come from the traditional athletic training sports med field. So working specifically with the sports team from professional all the way down to high school, we tend to do a lot of taping, right? We're taping ankles, Achilles tape job, arch tape jobs for plantar fasciitis, turf toe, right? We learn different taping techniques for a lot of different areas. Unfortunately, there was no studies showing the effectiveness for taping. A lot of people do respond fairly well that I've seen in my experience. However, putting tape on the bottom of the foot, again, if we compare white athletic tape or some of these stronger tapes like Elasticon and McConnell's tape versus Kinesio tape and rock tape, right? We have this varying degree of support that you're going to see. Some that are barely supporting in any way, like your rock tape and Kinesio tape. Others like McConnell tape, Elasticon, and white tape that provide more support. But then we debate, okay, as we're landing, we're changing directions, we're getting sweaty. How effective is that tape to continue providing support? Or is it something that we're just perceiving as, okay, this is helping me because it's supporting my foot and it's just mentally or psychologically allowing me to feel better? From orthotic standpoint, results are varied. When you look at over-the-counter versus custom insoles, there have been various research articles over the last 10 years or so that show custom orthotics have been no more beneficial than over-the-counter insoles. The goal of insoles or orthotics in general is to provide better passive support to the foot. So if we know that your foot is consistently collapsing and you're really stressing into that plantar fascia because the foot is collapsing itself, it doesn't have that integrity, that support, providing a rigid structure underneath can prevent you from going too far into that collapsed position, from overpronating. However, some research studies say, yes, that helps. Other, no, it doesn't. So it's very mixed. It really has to be kind of provided on an individual base standpoint. Rolling the bottom of the foot, couldn't find anything on that, not even a single research article. This is one of the most common things you'll hear from plantar fasciitis. So it kind of combines your cold therapy with your self-myofascial release. We know the self-myofascial release provides short-term benefits. Cold, they're saying, can be helpful because it's helpful to actually address musculoskeletal issues. However, if it's not actually a true inflammatory condition, like we're now starting to see, do we need to try to actually reduce inflammation? That's where the cold would come in. We might not even need that in any way. So it's very interesting, the whole frozen water bottle thing, but no research. So I kind of want to stay away from that a little bit. All of these, even though you're seeing I'm kind of standing in the middle here, some work, some don't, some effective, some ineffective. These are all passive treatments. So I highly recommend, if you're looking to modify your symptoms, if this foot is acting up and you do something here and it feels better, continue to do that thing. But just understand that just doing that thing is not probably going to be the long-term strategy to get you better. This is the starting point to help reduce symptoms. Can we get back to zero? And then how do we take that next step from there to truly get past this condition as we run, as we walk, as we jump, as we stand on our feet for a long period of time? Progressive loading, or strength training, rehabilitation, depending on how you want to look at it, has been researched more over the last, I think it's about 5 years or so, actually, when it comes to plantar fasciitis. The research has shown that actually plantar fascia stretching, as you'll see in this top left image, is one of the most reliable strategies to get over plantar fasciitis. So is this necessarily we're just stretching? Because if you think about it, right, this tissue at the bottom of the foot, we want this to be stiff. We want it to be rigid because that helps provide structure to the foot. A lot of people don't look at stretching from a loading standpoint. The more we start to stress and really create this lengthening or this tension on the tissue, the more we're adding load and adding stress into that tissue. So stretching it is actually the first step in loading a tissue. And then we start to add body weight, and then we start to add external resistance. So plantar fascia stretching has been known as a reliable strategy for plantar fasciitis, and then also various calf raise variations. Going back to the point that if this is not an inflammatory condition, it's a chronic degeneration of the tissue. The only way for us to actually send these cells and sending these chemical mediators into the area to allow this tissue to repair and regenerate and resynthesize is to load that tissue, right? Progressively overloading our body, as we know, allows our tissues to get stronger, more resilient to the stress and the force we place upon it. So unless we load our tissues, oftentimes we can feel better from some of those passive strategies, rolling on a ball, cold frozen water bottle, orthotics, but we need to address the tissue itself. And this is where a lot of people really miss out on those long-term benefits through this rehab process. From a exercise standpoint, we can do any type of calf raise, right? Calf raise, we think more so about the calf, which again, calf, gastrocsoleus muscles, Achilles, plantar fascia down at the foot. These things are essentially connected into one longer fascial line, like I talked about earlier. So we can do these calf raise exercises to build calf strength, improve ankle range of motion, specifically load the plantar fascia. And then we can get more specific, as you see on the bottom left here. These are plantar fascia variations of calf raises. So all we're doing here is we're elevating the toe on a towel roll in some way. So the toe is already starting in a slightly extended position. And then as we perform the calf raise, we're activating that windlass mechanism, which I talked about earlier, which tensions the plantar fascia. So we're creating more stress specifically in the plantar fascia. Recommendation here is to start on 2 legs, make sure you can tolerate it, and then go to a single leg. This is a research article, Ratliff et al. This is one of the best ones that has come out that has started the thought process on we need to load these things a little bit more than we are, these types of injuries. So does progressive loading actually help? This is the foot function index, which essentially tells a person's level of pain, limitations and disability from experiencing foot pain. You can see that at baseline, right, people are rating themselves up in this like 80, 70 range here. Over 12 months, you can see just the improvement in terms of pain and disability. People are feeling a lot better. People are moving around and becoming more active. What's really important to understand when it comes to this study is loading the plantar fascia, doing the plantar fascia calf raise variations showed a significant improvement at the 3-month follow-up point, right? So these people did the plantar fascia calf raise and some type of stretching. They did it every other day, which is the recommendation when you look at these chronic issues like your tendinopathies and your plantar fasciitis. However, in the long term, over 12 months, the improvement was about the same, whether you stretched the plantar fascia by itself or you did the strengthening exercise with the plantar fascia calf raise. But at a 3-month standpoint, significant improvement when it comes to doing the plantar fascia calf raise alone. However, in the end, the results are about the same. So this all comes back to what are your end goals, right? So if I have a runner that's right now, then for summer, I was just creating a program this morning for a runner. She has a race, Rock and Roll Nashville, which is coming up in exactly 3 months. If she came to me and said, Garrett, I have plantar fasciitis, and I know that race is in 3 months, you bet I'm going to load her as much as I can, because at 3 months, there's a significant improvement in her symptoms, right? She's down here with the strength training exercises as opposed to up here with just the stretching. So it really depends on long-term goal. If this is someone that doesn't have anything upcoming, right, we can change our approach based on the research here. But I would still definitely load that person in some way, because we're going to get better calf strength. We're going to get a better ankle range of motion, great toe range of motion, and just overall resilience at the plantar fascia itself. Our goal with these strategies is to stimulate what's called collagen synthesis. So we want these cells to go into the tissue, go into the plantar fascia, and stimulate healthy functioning tissue. We don't want to just relieve pain. We want to improve the tissue itself, so long-term that tissue can do its job to stabilize, to store and release energy. Biggest thing when it comes to loading, and where I see some people go wrong, is either you're not loading enough or you're loading too much. Is a fine balance of stress and recovery. So can we do some type of exercise every other day, allow a rest day in between, actually stress that tissue to the point where it's again, low level pain or uncomfortable. So we don't want pain to exceed a 3 out of 10 on the pain scale, but we want that pain to return back to baseline or to resolve within 24 hours. So if you're currently experiencing a 3 out of 10 pain as you do the calf raise exercise, it gets worse, it gets better, it resolves the next day, it goes back to where it was. That's where we want to be. So it's okay to stress these things to the point where they're pretty uncomfortable or even painful to a degree, but they need to return back to baseline. A lot of people are either stressing them every day, doing calf raises every single day, and like, I'm not getting anywhere, because we're not allowing the tissue to actually heal and adapt. Other people are not doing it enough, or doing the exercises twice a week, and then there's just too much rest in between. So we're not actually getting stronger. We're not stimulating that tissue to a degree which is going to promote healing. So we need to have that fine balance. And I find tweaking that for a lot of people, getting them more consistent, allowing them to stress and recover, and doing that consistently, building up repetitions, building up sets, adding a book pack, right? Adding a backpack on their back with textbooks in it to make it a little bit more challenging. Those little things over time, which allow people to really get past this the right way. Now we need to understand, is there a biomechanical component? So all those passive treatments I talked about earlier, that's trying to address the tissue itself. However, if the tissue is not the problem, the tissue might have become the problem because I'm not stabilized. I'm weak through those intrinsic muscles of the foot. I'm not stabilizing my foot well. My calf is weak. I have limited range of motion at the big toe or ankle. I'm really not stabilizing my hips well, which is causing me to overpronate as I land or strike the ground when I run. Unless we look at some of these other things in the process, we're going to hopefully improve or reduce pain at that tissue, but we're not going to address the underlying cause. So as we're trying to reduce symptoms, that needs to be a priority. We want people to go through their day with less pain first, right? That's always the initial priority of any rehab program. And then secondary, can we address the underlying biomechanics, understand why is this person overstressing, creating pain in their plantar fascia? Is this just a plantar fascia issue, or is there something else that's predisposing to them? It's very rare that you're going to see me recommend to someone here, just take anti-inflammatories, roll with a water bottle, stretch this tissue, or just strengthen this tissue. Usually it's part of a bigger treatment program, rehab program. We need to strengthen the hips, teach them how to control their pelvis, strengthen some of those intrinsic muscles of the foot, toe yoga, lift, spread, reach, just basic strengthening through some of those flexors down there. There's a lot of other things that need to accompany your plantar fascia rehab program. So you're not just trying to reduce symptoms, you're reducing symptoms, improving biomechanics, and then functioning better as a whole to not overstress this tissue down the road. Now, take home message here as we start to wrap up. You need to get evaluated, right? We're so quick to incorporate some of these passive things. We're changing shoes, we're putting orthotics in, we're rolling with cold water bottles. We're doing these things. It's an okay starting point, right? Very mixed in the research, but it's a good start. Understand why you're experiencing plantar fasciitis. If you're someone that's been dealing with this on an ongoing basis, feel free to reach out. We'd love to talk to you about that. Improvements are seen with conservative treatments. This is interesting and important to understand. We do see improvements with conservative treatments. However, 40% of patients continue to have pain after 2 years, right? So that's this person on the side right here. This person's been waiting and waiting to feel better from their plantar fasciitis just because these things are very tricky. They don't respond well. We're on our feet often. It's hard to reduce load on this tissue, reduce symptoms, improve just overall strength and resiliency of the tissue to get past it. So if you're experiencing plantar fasciitis, just know it could linger for a fairly long period of time. 40% of people, I mean, that's a lot. 4 out of 10 are still experiencing symptoms 2 years later. So that's why I always recommend people get on top of this early. You don't want to fit into that category and make this a super chronic thing. Get on top of it early, understand the biomechanics, understand how to treat it, relieve pain, adjust and modify your activity. Because that's going to be super important in the long run. Like I just mentioned, modify your routine. We can't continue to do the same things and assume just by adding these passive treatments, by adding these exercises, essentially that's just adding more stress on the tissue. You might need to back down somewhere. You might need to make sure you're not standing as much, right? Or you're not on your feet as long throughout the day. You have good fitting shoe wear that supports you, that's either soft and supple or it's rigid to support the arch depending on what your deficiency is. We might need to modify your running, right? Limit the higher impacts just so we're not stressing that tissue continuously. Sometimes taking a step back is the fastest way forward. So understanding how are we loading that tissue? How are we overstressing it as we add some of those positive exercises in to deal with it appropriately. And then combine passive strategies for pain relief with stretching and loading to address specific structures, right? Understanding your biomechanics, loading the plantar fascia, the calf and the Achilles, but then doing whatever you need to do to allow us to feel better on a daily basis. Is that rolling the foot first thing in the morning? Because as soon as you step down, it feels like glass. Is that adding a certain cool down or something after your run? Because that's when things usually get to its worst. Combining both of these strategies rather than thinking it's one or the other, let's combine these into one more cohesive and well-rounded program. All right, guys, so let's start to wrap up here. I don't want to take up too much of your time on this Sunday morning. Feel free at this point, if you have any questions specifically, drop a question in the chat box and let me know kind of what you're thinking here, any feedback, anything to share with me directly. I also know I will be sharing the replay tomorrow at 11 a.m. Hopefully this provided some insight and some guidance for you. I know it's very hard to sift through the research to know, like, hey, exactly what do I need to do to get past this? That's like research for everything. All of it comes with doing a good evaluation, passive treatments to reduce pain, active treatments to actually restore the quality of the tissue, and then modifying activity to allow you to get past that once and for all. So feel free to drop a question in. Take home a good message from Jessica here. Don't change shoes 3 weeks before race day in a long run. Another important thing, right? With all of this stuff we think about, it's all about how does the body able to withstand stress. So in her situation, if you change shoes, I mean, even it could potentially even be the same shoe, but a broken down shoe to a brand new shoe, your foot is going to respond a little bit differently in that shoe. So if we change things too quickly and we're continuing to run high mileage, that small thing of just changing your shoe could create this cascade of events that leads to plantar fasciitis. I know other people are just not changing their shoes quickly enough, right? Wearing the same broken down shoe for a long period of time. Over time, as that shoe breaks down, that foam starts to compress, not really do its job. We're losing the stability and the control in the shoe, or we're just creating that wear pattern that's going to put us into a position that stresses the plantar fascia more. That could be something as well. In the end, all of this stuff comes down to not making huge changes, slowly and gradually building up the strength in the tolerance of that tissue to withstand load. If we make big changes in any way, whether it's speed, running volume, shoes, adding too much strength training, all of those things can combine to create some of these issues, not just plantar fascia, but overall. So it's important to realize slow, gradual progressions over time, no big jumps, and just make sure you're not overstressing the body. So that's it, everyone. I hope you have having a great start to your Sunday. Any other questions, anything for me directly, feel free to reach out. I appreciate you guys for joining on here on this Sunday morning, and I hope you enjoy the rest of the day. Thanks again, and I look forward to chatting with you guys soon. Thank you.